type now.
Good afternoon, viewers. Welcome to Cancer Reach Cancer Awareness Live Session. So, in past 7 to 8 weeks, we have been discussing about the cancer awareness topics that include breast cancer, lung cancer, ovarian cancer, liver cancer, and today we are here to discuss another important cancer, that is pancreatic cancer. That is the 11th most prevalent cancer in India, that also cause a leading death factor in India. So we have Dr. Krishnamani with us here today on behalf of Cancer Reach. Cancer Reach is the initiative initiated by Dr. Krishnamani to spread awareness about cancer and also give a proper guidance to the patient and caregivers to access the right treatment on right time. Right, Dr. Krishnamani, we welcome you for this live session on pancreatic cancer. Welcome, sir.
Thank you very much. Thank you.
Sir, we request you to give a little brief about the importance of uh, pancreatic cancer awareness and as well as the November month, especially.
So, first of all, welcome all to Cancer Reach. And Cancer Reach, as you all know, is an initiative to spread awareness about cancer. Each month, we bring about information, and the aim is to spread knowledge on certain cancers on those respective awareness months. November is also a pancreatic cancer awareness month, and hence that's our main reason to focus on this deadly type of cancer, which is extremely dangerous, has a very, very poor prognosis, and it's almost like a death sentence to a cancer patient. So that is precisely the reason we want to talk about pancreatic cancer today. And that said, what we would like to emphasize is that we are dealing with the disease on hand, which is a kind of aggressive, for which there has been little progress over the last few decades. But efforts are on by people all across the world, including researchers, doctors, scientists, oncologists, to improve the survival in this disease.
Doctor, as you rightly said, even I have come across few cases recently, like after diagnosis in just few months, we missed them. So that we understood the severity of the pancreatic cancer. So thanks to you to join with us in this live session to enlighten more as on pancreatic cancer. And doctor, why we call this cancer is a deadly cancer, and how it is, I mean, sorry, what are the causes of this cancer first?
So what we should understand is, let's learn a bit about the pancreas itself. So pancreas is an organ in your body which has exocrine and endocrine function. That is, exocrine means it secretes some enzymes to digest your food, basically, to keep it in very simple terms. Endocrine means it secretes hormones. Most important hormone is insulin, to keep your glucose levels under control. So if your endocrine part of pancreas is damaged, you develop diabetes. If your exocrine part of pancreas is damaged, you have pancreatic enzyme problems. Okay, so that is what is a pancreas. Pancreas, if you look at the structure, it has a head, it has a body, it has a tail. Now, in pancreas, you can have variety of cancers like adenocarcinoma, neuroendocrine carcinoma, rare tumors like lymphomas, cysts, etc. But the most common cancer in a pancreatic organ or tissue is pancreatic adenocarcinoma. And this is the most deadly one. And this is what we are going to talk about in the next half an hour. So, pancreatic adenocarcinoma is commonly seen in the head and the body, but you can also find in the tail of the pancreas, number one. Number two, the most important risk factors are cigarette smoking. Smoking contributes to almost 25 to 30% of pancreatic cancers. And the risk increases with the number of cigarettes you smoke and the number of years you smoke, which is called pack years. So if any of your viewers heard our previous live sessions, what is a pack year? If somebody smokes one pack of cigarettes a day for 10 years, he has smoked 10 pack years. The same person has smoked 5 packets per day for 10 years. 5 into 10 is 50 pack years. So on one side you have 10 pack years, another side is 50 pack years. That is 5 packets per day into 10 years. 5 packets per day into 20 years. The more the number of pack years, the more the chance of getting pancreatic cancer. And once you stop smoking, if you completely abstain, the risk comes to a normal level if you are almost 10-15 years and you have quit smoking. So smoking is the central thing for pancreatic cancer. Another important cause of pancreatic cancer is a high body mass index or obesity, being overweight. People who have a BMI of more than 30 have a high risk of pancreatic cancer. That is what studies have shown us. Pancreatitis can cause pancreatic cancer. So what is pancreatitis? Your pancreas is constantly damaged by some insult or the other. So what happens is after many years, the organ has got tired and it produces certain cells, or the cells have become bad cells and they grow into cancer. So constantly after insult, after insult, after insult, the good cells have slowly become bad cells and they transform into cancer cells. So that is a third risk factor, which is pancreatitis. Last one is familial. That is again of two types. You have people in the family who have pancreatic cancer, for which you do all the genetic tests, you are not able to find out any gene. So you will call those people not having any genetic predisposition or particular gene, but they have a family risk. Many people in the family are affected. The other side is many people are affected and they have a genetic or mutation or a gene mutation. For example, BRCA1, BRCA2, what you see in hereditary breast ovarian cancer. So these are the four common causes of pancreatic cancer. Some links are there between coffee usage, alcohol usage, less amount of fruit and vegetable in your diet. All these are not very clear cut, but yes, association exists between alcohol intake in pancreatic cancer, excess of coffee, but it's not very clear. And always a healthy, balanced diet is what is promoted. You have more fruits, more vegetables, more fruit juices, and a balanced diet of protein, carbohydrate, and minerals to prevent any variety of cancer.
Doctor, as you rightly said, this is the BCRA1 and BCRA2. These are the common genes that are transferred from one generation to the other generation. Like, what is your suggestion for the people who have that familial history? Like, how frequently they have to go for a checking? Like, how frequently they need to attend an oncologist if required?
So viewers, please understand. We call this screening. Screening means test done in a general population to identify a disease early. Number one. In the general population, to detect pancreatic cancer early, there is no screening test. So you and me who have no genes, we need not get ourselves tested. People who have multiple members in the family affected, or as you said, BRCA1, BRCA2 genes, or other genetic conditions like some rare syndromes like Peutz-Jeghers syndromes, Lynch syndrome, etc. Those people need to start getting evaluated by the age of 40 or so. What you suggest for them is they do an MRCP and an endoscopic ultrasound once every 1 or 2 years. MRCP is like an MRI, okay? And endoscopic ultrasound is they put a small tube through your mouth into the digestive system, and they try to look if there is something there, if there is a solid area or a cyst or any abnormality. So the rule is there is no screening test for general population in patients who have in people who have BRCA1, BRCA2 mutations or high risk in the families. Do an EUS and an MRCP after you consult your doctor, maybe once every 1 or 2 years. Also, a blood test called CA 19.9 is not mandatory, but it is optional.
So maintaining a balanced, healthy diet and avoiding alcohol and avoiding smoking, and be little cautious when you have familial history of these cancers that always protect or save us. At least we can take a preventive measures to get away from this pancreatic cancer. Thank you, doctor. Thank you very much for bringing us such important points to us. And doctor, when you said in the beginning, like a majority of the cases, pancreatic cancer is diagnosed in the advanced stage. Like, how can we detect it early and how to take a measures early?
So the unfortunate part of pancreatic cancer is by the time you develop symptoms, the disease is advanced. So how are you going to detect early? Stop smoking, no alcohol, a balanced diet, healthy lifestyle, walking, running, gymming, yoga, whatever you call it. These are all to prevent not only this cancer, to prevent all lifestyle diseases, so be it diabetes, hypertension, obesity, etc.
We are just reducing the risk of cancers.
Risk. Despite this, if somebody develops cancer, it is unfortunate. But unfortunately, for pancreatic cancer, as we said, there is no screening test. When it presents with abdominal pain, severe abdominal pain, chronic pain for a very long period of time, which is not responding to your conventional painkillers, weight loss, loss of appetite, vomiting. These are all alarming symptoms. So people would tell you, I've seen you 1 month back and you look a different person now. How you have lost so much weight? And the weight loss is like 8 kgs, 12 kgs in 1 month. It's not half a kilo or 1 kg. So pancreatic cancer weight losses are that bad. It is glaringly visible. So by that time you develop these symptoms, it is usually advanced. At least stage 3 or stage 4, what we call. It may not be operable also in some patients. So that is why it is better to have a healthy lifestyle and hope to beat this cancer rather than get this cancer and try beating it. Because when you develop the cancer, unfortunately, the cancer doesn't give you many chances. And in those who have the hereditary risk, get yourself screened regularly so that if you detect this at a very, very, very early stage, by MRC, or endoscopic ultrasound, or by CT scan, you can operate. And once you operate, that's a very good sign. Though even after you operate, 60% of the cancers can still come back, maybe, but that's a different issue. At least you have a chance of surgery, and surgery is your only chance to potential cure.
Doctor, of course, now you have discussed about surgery. What are the general treatment modalities available for treating pancreatic cancer?
Broadly, when we talk about cancer treatment, is it curative? Is it palliative? Curative means cure, palliation means control the symptoms to prolong life. When you talk about cure, surgery is the mainstay. No curative treatment in pancreatic cancer without surgery. You cannot. So always try to operate when you can. The next treatment is chemotherapy, and the last treatment is radiation. So you give chemotherapy with radiation, or chemotherapy before radiation, before surgery or after surgery. In all ways, this is a mix and match so that you get the best outcome. When you talk about stage 4 cancers, it is usually chemotherapy. Surgery has no role. Chemotherapy to prolong life and improve the quality of life.
Doctor, in this chemotherapy, like how it is going to be, a patient need to be hospitalized and get the medication in the hospital. Are there any possibilities to take the medication at home, like a oral therapies are available for pancreatic cancer?
So pancreatic cancer regimens are kind of intensive treatments. So if you want to give the best possible chemotherapy regimen, it has a good amount of side effects. So take those side effects. Your general condition should be good. Also, to give that medicine, you cannot give it through the vein because you'll going to damage your veins. So you have to give it either in a PICC line or a chemo port, which is a device through which the veins are not damaged and the chemo can be given. Now, these medicines sometimes are given for a continuous 46 hours infusion. So they have to go on
Continuous,
for 46 hours, continuous.
continuous.
So even when you're sleeping, the medicine will be constantly going inside. Earlier, patients used to be hospitalized for 46 hours. Now, what we do is we have small pumps. So we load the medicine in the, it's like a small bottle, keep it in the packet, and send the patient home. The pump has a small bubble, or a balloon rather, the medicine is loaded into that, and slowly after 2 days, it shrinks. That means the medicine is getting emptied into your blood.
Like,
So you come after 2 days. What was like this, that balloon with the full medicine, after 2 days is shrunk. So when you come after 2 days, the sister or the nurse will remove the needle and send you home. So now, even for intensive chemotherapies, you don't need to be hospitalized. You are at home. So unnecessary cost of hospitalization, chances of getting infection from other patients, all that is minimized. If you are not that fit, your doctor may choose less intensive treatment, which can include oral medication, like what you said, a drug called capecitabine, which can be taken at home.
clear, very clear, doctor. Doctor, I have one question here. Like radiation therapy, you said in the beginning, like what is actually the radiation therapy and how it is given? And in this pancreatic cancers, what is the role of radiation therapy? Can you please little elaborate, doctor?
See, surgery is the mainstay of treatment. Even if I tell you 1,000 times, that is not enough for this cancer. That is what I want our people to understand. Now, there is a particular variety of pancreatic cancer most of the time where you call it unresectable. Unresectable means you cannot operate. The tumor is very close to all the neighboring structures. There are important blood vessels which go near the pancreas. This tumor has gone and attached itself to all those nearby blood vessels, arteries, and veins, because of which the surgeon cannot completely remove the tumor. This, when you do a scan, you will get to know. On the scan, usually your doctor will tell you this is an unresectable tumor. So when you have an unresectable tumor, but it has not spread anywhere, it is in the pancreas only, it has not spread, it is not stage 4, but you cannot operate also because all your major arteries and veins are involved. In that case, you will give chemotherapy or you'll also give chemo plus radiation. Why you add radiation? For good local control. When you're going to do surgery, you may not give radiation. You'll probably do chemo first and then do surgery or directly go for surgery. Radiation is usually in unresectable cases when you cannot operate. Then what you want is at least give radiation to shrink the tumor so that the pain control or local control or symptom control is better.
Clear, doctor. Doctor, there is a question from Mr. Ramesh Gupta. Is there any relation between the diabetes and pancreatic cancer? And are there any chances of diabetic patient getting pancreatic cancer?
It's a wonderful question. I wanted anybody to ask this. The reason being, as we discussed in the first few minutes, pancreas is an endocrine function. So when pancreas is damaged, even due to cancer, diabetes is one of the first symptoms. So many times when our patient is diagnosed with pancreatic cancer, that is the first time he is diagnosed with diabetes also in his life.
So there is a link between pancreatic cancer and diabetes.
But the link is not as simple as we all think. It is not a casual link that diabetes causes pancreatic cancer or pancreatic cancer causes diabetes. It's not linked. So when you develop pancreatic cancer, most of the time, if you are not a diabetic, you become a diabetic. Or if you are a diabetic, your sugars go out of control.
Okay.
So the patient would say, I am diabetic for last 10 years. My medicine requirement is like this. My sugars are like this. Now, my sugars have gone up so high. Insulin has gone up so high. New medications have started. Doctor has evaluated me. I've lost a lot of weight. And now they say I have a tumor in the pancreas. That is the thing. And the reverse, that diabetic causes pancreatic cancer, that association is not very strong. So you cannot say that if you have diabetes, you'll get pancreatic cancer. No. But when you have pancreatic cancer, more or less, patients do develop diabetes or the diabetes fluctuates.
So it's like, can I say like this, like all pancreatic cancer patients may develop the diabetes, but all diabetes patients may not develop a pancreatic
That is
cancer.
for sure. Diabetes is so common in our country. We are the world's capital for diabetes.
Yes,
Does
sir.
everybody develop pancreatic cancer? No. If that would have been case, pancreatic cancer should be the number one cancer in the country. No.
Oh,
So, and that is kind of fear mongering, saying that all diabetics is equal to pancreatic cancer. No way, it is not at all. But what you should understand from this is, if you're a diabetic and your sugars are going out of control, or if you're a newly detected diabetic and you don't have any family history of diabetes and you never had diabetes till the recent past, then just think once again, and it could be pancreatic cancer too. It is not that you always have pancreatic cancer, but just watch out.
Sir, there is a different question. Mrs. Swarna, sorry, she's Miss Swarna. She got a question like it's a different question, peculiar question. We are also listening for the first time on these live sessions. I got an alliance match recently, but his father recently died with pancreatic cancer. But is it as suitable for me, or can I opt this or not?
That's not a, just because somebody has had pancreatic cancer, if we are going to not go ahead, then what's the guarantee that tomorrow we are not going to get cancer? In that way, nobody can get married to anybody, because all of us have a risk of cancer. As I told you, it is not a completely hereditary disease or genetic disease and all that. Because of improvement of so much of science, we are finding some clustering in some families. So just because his father had doesn't mean he is going to have, and you should not marry him. You marry him or don't marry him is purely based on you like him or not and multiple other factors. But pancreatic cancer in this has no role.
Sir, generally, in my, I have a doubt in this point of view. Like if someone like father and mother, they have died because of some cancers. In those cases, like are there any chances of their offspring, their children, they get those kind of cancer? Like how they have to be cautious in their lifestyle?
So imagine there is some guy, okay? His father smokes, so he had lung cancer. His grandfather ate tobacco, so he had oral cavity cancer. So does that mean this guy will get cancer?
No, sir, because of the bad habits what they are
Uh,
continuing that cause cancers to them.
but the way we are going to look at it is, oh no, no, father had, grandfather had, so this fellow will also have. Like that. So familial cancers are few, like hereditary breast, hereditary ovarian, few pancreatic, few prostate cancers, etc. Okay, so there you have a particular system which we have discussed in our previous episodes also, where you are going to screen such people, or you have to watch out for the family members, children, siblings, etc. Otherwise, no. Otherwise, just because somebody has, most cancers are sporadic. Sporadic means they come just without any reason.
And doctor, are there any common screening tests available for a general population? Suppose if I want to identify, do I have any risk for any cancer? Are there any genetic tests available for common people?
Screening test is different, genetic test is different. Screening, we have already discussed. Again, for the benefit of the audience, one more time. Mammogram for women above 45 or 50 years, every year or once in 2 years. Pap smear every 3 years for women above 21 years. Cervical cancer vaccine for girls and boys between the ages of 9 to 13 or 9 to 22. Okay. Screening tests for men can include colonoscopies once every 10 years after the age of 50 years. And in high risk men, you can do probably PSA after 40 years or after 50 years.
For prostate cancer.
Prostate cancer.
Doctor, what are the newer advances that happen in the field of pancreatic cancer management?
So the newer advances in pancreatic cancer is, one is imaging, CT scans, endoscopic ultrasounds. You're able to find out quickly, earlier. Another important thing is this research on familial genetic clustering, identifying patients who have BRCA2, PALB2 gene, etc., where you are going to subject them to screening. Two, three, awareness about the cause and effect, smoking, tobacco, obesity, so that we can educate people. These are the newer advances. Four, excellent chemotherapeutic agents, which have definitely a lot of side effects, but which increase the response rate, increase the survival of the patient. Five, beautiful methods to deliver the chemotherapy, be it a chemoport or a PICC line. Earlier, patients have a lot of problems. Their veins used to get damaged. It is called extravasation. They will develop ulcers in the hand. Now, all that can be avoided. Excellent medicines to prevent the side effects of chemotherapy, like vomiting medicines, growth factor injections to prevent infections. These are all not there 20 years back, or not at that level where we use it now. Beautiful radiation techniques. Lot of centers with excellent surgical expertise. Pancreatic cancer surgery is a very complicated surgery, should be done by experts. And now you have very good surgical oncologists in India in most cities. And in a city itself, you have multiple people, almost 20 people, 15 people, 25 people, who can do beautifully complex surgeries very well. Okay. And then finally, when it comes to stage 4 pancreatic cancer patients, it is all about palliation, pain control. You have beautiful medicine, you have excellent ways to control the pain now. Earlier, we just used to give them certain kind of painkillers. Now you have patient controlled analgesia, we call it. That is, it's a pump where the medicine is there. You have a lot of pain, you yourself pump, press it, the medicine gets pumped into your blood system, and the pain gets controlled. So, right from screening, symptoms, diagnosis, imaging, scans, treatment, taking care of treatment side effects, surgery, and when it comes to end of life care, there is so much of change which has happened in the last 30 years to make life better for pancreatic cancer patients.
Great, doctor. Great improvement, because that gives a lot of confidence to the people who recently got diagnosed, or anybody have their family members diagnosed with this disease. They should not be worried much. Of course, as a human being, as a doctor, everybody, they give their best, and we hope them healthy lifestyle and a better life. Doctor, there's a question from an audience, Mr. Ram Sharma. Why cancer patient lose weight? What is the interlink between the cancer and weight loss? He's asking.
Simple, very simple. Keep it very simple. The cell in your body is sitting and eating you up from inside. What you eat, it is eating it. What you don't eat also, what is stored in your body also, it is eating it. So literally, it is draining away. It's like a rat which is sitting inside and eating away, or a worm which is eating away.
Your complete energy, nutrition, food, everything
Everything
is
is
taken
gone.
by the
Everything
cancer.
is gone. Everything is gone.
But as the tumor goes growing on, and if we give extra supplement from outside, can we balance the patient weight in the future?
Unless you kill the cancer or the disease is under remission or control,
Should stop the leakage first.
yes, you are not going to control anything. You cannot say
So
that I'm going to feed you 100 kilos of protein and make up your protein, but the cancer will still be there. The cancer will easily eat away on that.
and doctor, are there any changes in the eating habits or in the cravings of the patient? Like if anybody have the cancer in, like in as initial symptoms as signs, can we consider it?
See,
Some people says that I don't feel like eating. I feel like my mouth is a little bittery. I don't feel like drinking anything. So those kind of complaints we listen from many times. So are there any link between that?
yes, that's a common complaint which our patients have. That is due to the cancer also, and also due to the chemotherapy or the other treatments they receive. But try to motivate yourself. Uh, Gargle your mouth well to prevent mouth ulcers. Eat home food. Eat a balanced diet. Take small, frequent meals. Take different types of food, so that the taste is different and you feel better. More importantly, you have to motivate yourself that each day is probably going to get better.
Rightly said, doctor, because it's our fate that has decided whether cancer has to come or not. But as a human being, as a fellow, we have to give our best to support our cancer patients. And on this occasion, doctor, I would like to thank you very much for your kind, valuable time to spend with us, and as well as your efforts and intention to help all the cancer patient and people who are at the risk also. So thanks a lot from all our side.
Thank you very much. Thank you.
Thank you, doctor. Have a great day. We'll catch up in the next session with another interesting topic, which is more helpful for our patients.
Thank you.
Thank you, doctor.